why do I actually need to go ahead and cut off my breasts? I am BRCA1 positive and I've been under surveillance for 10 years. And now that I'm preparing for my preventative surgery, many people ask me, why do you have to do it now? Why can't you just keep on what you were doing till now and just do the scans every year, the MRI, the mammography? Why can't you just do it more often and have a earlier result if you have any suspicious lump or anything like that? This surgery is definitely not for everyone who's in a similar situation, but I think for me, I've came to the understanding that with such a high risk of having breast cancer of about 87% in a lifetime, it is really just a matter of time until one of these tests come out with a suspicious finding. I would rather be on the side of having the advantage of doing a preventative surgery and not a treating surgery, because then I have more options as to what type of surgery, what's the result going to be looking like, and I can do it on my own terms and not have an emergency to an illness. And also, I didn't want to be in the situation that I am already a cancer patient. With BRCA1, most cases, if you're gonna get breast cancer, it's gonna be a triple negative, and it's the kind of cancer that would not be able to treat with anything biological. So that means that even with the smallest finding, I'm gonna have to go through chemotherapy, even if I'm discovering really early on. And I didn't want to have to go through this long term. There's actually a third reason which I think sealed the deal for me, and I'm going to talk about. And the third reason is actually something that not a lot of people talk about, but I had to find it out kind of casually. As a BRCA1 positive, you not only have higher risk to breast cancer, but also ovarian cancer. And the recommendation is to have your ovaries cut off at 40. And the implications for that hormonally are much higher. Being forced into induced menopause, and I knew from my research that I wanted to start with hormonal therapy as I do this surgery for my ovaries. If you're a cancer survivor, breast cancer, you're not gonna get your normal hormonal therapy as the other person would. So I wanted to have my breasts removed so that I don't hurt my chances of being able to use hormonal therapy once I have my ovaries removed in about 2 years from now, because I'm 38 now. This kind of topic doesn't really come up with your doctor's appointments. From the research that is known, hormonal replacement therapy is crucial for your brain health, your bone health, and just your mental health, plus all the symptoms that menopause can bring. And I don't want to risk my quality of life